everyone, Dr. Jeff here with you today. I get this question in my office sometimes, what was this big machine that sits in my office, what does it do? It looks kind of awesome. It's called a carpal tunnel distraction machine. We've had it since the 1990s. There were 12 of them built in Ontario. They were actually designed by a chiropractor before he passed his way. It's designed to treat something called carpal tunnel syndrome. Carpal tunnel syndrome is a condition where there's no pain involved, but your hand goes tingly and numb. It's generally the thumb, these two fingers, and half of this finger. The ulnar nerve does the baby finger and half of this finger, and it runs outside the tunnel. What can happen is you have a ligament around here called your carpal ligament. The median nerve runs right through the carpal ligament, through the carpal tunnel. With overuse and doing things with your wrist, those tendons can swell up, create swelling, creates pressure, pinches off the nerve running through, and you get the tingling and the numbness in the hand. There's no real pain with this at all. There's more tingling and numbness with it. So what the machine does is with your arm in here, the machine will gently pull and distract your arm out here. It also pulls it to the inside and pulls to the outside. So what we're trying to do is we're trying to stretch that carpal ligament, stretch it out to create more space underneath it, more space in the carpal tunnel, take the pressure off the nerve. We're usually fine with this. It's a 12 treatment protocol, 3 times a week for 4 weeks, but it's usually around the 8 treatments a wow moment where the hands don't wake you up anymore. Because generally the carpal tunnel, the hands wake you up at night, you have to shake them out. You know, driving, riding your bike, reading a book all brings a tingling numbness on. So that's what this machine is for. We also find that the median nerve starts in your neck and runs down your arm. So while you're here, we're checking other areas where the nerve can be pinched. Some people will get something called a nerve conduction test done. Shoots a current down your arm, measures how long it takes to get down. If there's any delay at all, they tell you have carpal tunnel, but that delay, they don't tell you where. It could be in your wrist or your elbow or your bicep. So we check everything to make sure. That's why our treatments are about 80 to 90% successful versus carpal tunnel surgery, where what they do is they take a knife and they just slice your carpal ligament open, takes the pressure off right away. Your hand feel much better right away. But the problem with that is that the scar tissue after you have the surgery can adhere to the tissues underneath. So it doesn't take long after that for that scar tissue start to adhere to the tissues and cause more swelling. So that's why surgery is about 70% successful. We're 80 to 90% successful. Our internal stats here show about 84%. So that's the success rate. It's very gentle. We combine it with cold laser therapy. So that's what the machine is all about. It's for treating carpal tunnel syndrome, which is where your hands start to fall asleep and go tingly, especially at night and maybe when you're driving. So if you have any questions about it all, you can always talk to me here on Facebook or at Goldsworthy at goldswells.com. If you're suffering from carpal tunnel, you can always come in and talk to us. I'm Dr. Jeff, and I've got your back.